Welcome to the Nursing Post podcast, All Nursing All the Time with Ashley Moore and Rosa Horsley. Today we're talking about telehealth, the good and the bad. Our goal is always to inform and start conversation.
So in 2020, looking back, it's almost like, did this happen? Yes.
Yes, it did.
It did. It really did. And I think now we're just getting to the point where we're like reflecting and looking back in the rearview mirror to say, hey, what did we learn? And with all the bad and the ugly with 2020, there was some good things that were brought out.
Mm-hmm.
Disparities was one of those things that we brought to light. There was a big spotlight on disparities, which we needed to bring to the forefront. And telehealth was another one of those things.
Mm-hmm. And
telehealth is not something that's completely new, but it was not something that most facilities were set up for.
Correct.
And according to the AHA, telehealth connects patients to vital health care services through video conferencing, remote monitoring, electronic consults, and wireless communication. So you may ask yourself, what does one have to do with the other? But we're going to go into that on today's episode.
So I found some statistics, which I figured it wouldn't be so hard to find because like a lot of things that happened last year, it happened quickly.
And it's all the rage.
It is all the rage. So according to FAH, a report from the CDC found that there was a 154% increase in telehealth visits during the last week of March 2020 compared to the same dates in 2019.
Mm-hmm.
The CDC also found that about 1.6 million telehealth encounters occurred from January through March of 2020. 95% of employers are confident their organizations will continue to sponsor healthcare benefits in the next 5 years. 40% of millennials said that a telemedicine option was extremely or very important to them.
Mm-hmm.
So I guess that's why these employers
are wanting to
continue.
Sure.
Numbering 83 million, millennials now comprise the largest segment of today's workforce. Millennials place high value on both ensuring convenience and limiting treatment costs. Just 67% of millennials have a primary care physician compared with 85% of baby boomers. 79% of patients said that scheduling a telemedicine follow-up visit was more convenient than arranging an in-person follow-up. And 61% said that the time spent in a virtual waiting room was also shorter than an in-person visit. The net cost savings is estimated at $19 to $121 per telemedicine visit, depending on where the employee would have sought care.
So those are some pretty big numbers.
They are. I mean,
when you add up
the cost,
the amount of patients that some of the physicians and APPs see.
Yeah. I mean, we worked through this.
Mm-hmm.
We did the whole telehealth situation during last year, and we did see a lot of its benefits and a lot of its, not benefits.
Mm-hmm.
So it's just interesting to see that even though this existed,
mm-hmm.
it's not going anywhere.
Well, I think all of a sudden compliance becomes easier when you just need to follow up with somebody for something simple, just to have that face to face and say that the patient's doing what they're supposed to be doing, or if you prescribe a new medicine and you want to follow up to check the, efficacy
of it.
Maybe something simple like a blood pressure medicine, but the patient can take their blood pressures at home and log them and bring them in or have those available for the appointment. Well, then you still have the same data.
It's true. Like I was saying, telehealth existed for years. It only just became, very prevalent and popular within the last year or so.
Mm-hmm.
And with the pandemic last year, being quarantined and in lockdown, a lot of people just weren't able to receive like in-person medical care.
Right.
And it only made sense to bring the office to the patient, so to speak. And being nurses, we had that firsthand experience. And yeah, there is a lot of good, just like you said.
Yeah.
With having telemedicine. you can reach some of those disparities in medicine.
Mm-hmm.
Like if you don't have a car, you don't have transportation, financially, you don't have money for gas, even if you do have transportation.
That's a real thing. Like that's something I hear all the time, especially working in a rural facility where some people are having to travel 45 minutes to come to a small town to be seen. They're like, I don't have the gas to go back and forth to see the doctor and to do all these things. It's hard for them.
Well, there are a lot of people who live on a budget. I mean, that's just the way the world works at this moment in time. Even before the pandemic, I know a lot of people, we all kind of lived on a budget, period.
Yeah, most people get a paycheck and it's a fixed amount.
And then if you're elderly, you're living off a pension. And sometimes that pension isn't even enough. And a lot of people are trying to choose between, paying for medications or food.
Yep.
So now you're having to add in somebody that may have like several medical conditions and all these doctor's appointments. So it adds up. The gas does add up. I've heard that several times. I don't have a way to get there. I don't have the gas. I'll have to take a taxi. I don't have money for the cab. You know what I mean?
And if there's somebody in the family that can take them, well, a lot of them want to be compensated for gas and time.
Exactly. Or it's got to be around that said person's schedule.
And then you're trying to coordinate. It's a lot. So those are the good things about it, but there are downfalls to it. You don't have a physical exam. And there are times that doctors need to physically examine you. They need to listen to your lungs. They need to listen to your heart.
Absolutely.
They need to palpate. There's other things that have to happen to really get a good diagnosis. There are things in telemedicine now where patients can actually like put stethoscopes up to their heart and the doctors can hear it. But
it's not the same.
It's not the same. It is less reimbursement for the providers. So they're still expected to do the work.
But get paid less.
More work, because now they got to make sure that they do all this research before they see the patient, and then go back and make sure that everything gets followed through with.
That's correct. And they're at that disadvantage of not having the patient physically in front of them.
Right.
So, yes.
There can be concerns that are missed or not addressed. So if you're seeing somebody and they say that they're doing well, that they don't have any swelling, but what they think of swelling and what you think of swelling are different.
Two different
But
things.
you're not seeing their ankles unless you ask them to show. And some people don't have the ability.
Yeah.
Right. Trying to stick your foot up or something crazy. But not being able to physically see them, they may miss things. Like, oh, no, hold on. This is swelling. And they're like, no, my legs always look like that. Well, yeah, it may, but that's still not normal.
Absolutely. I can see where that could get missed.
You can't build a good trust relationship over a computer, in my opinion.
Yeah, it's hard to build good rapport. I would say it's very difficult to develop like a really good bedside manner, as they say.
Right.
Electronically.
Yes. And if you know your doctor and you just do telehealth every now and then, well, then that's one thing. You've already built that relationship, that trust. But if you've never met that doctor, like on some of these apps, you don't know these doctors. They work for insurance companies. They work for themselves in the private sector. You don't know them. So you're just kind of like waiting for somebody to pop up on your video, and you don't know who's going to pop up and what their credentials are, and you don't really have time to research it. So
and this happened to me recently.
Did it really?
Yeah. The last holiday we had, I started like that Friday night, just feeling bad after a couple of weeks of, the sniffles and everything. I was like, oh, it's just the pollen. So, you start taking, your Zyrtec more vigilantly. And then you're starting to take your Flonase, just every day or twice a day, trying to get ahead of it. And then the weekend happened and I was like, oh, my friend told me about this one app. Let me try this since my doctor's office is closed. And so I go onto the app, they have you answer all these questions, they make you pay just a tiny fee. It's not expensive. They don't go through your insurance. That's why I think it was like something like $45 or something, which isn't bad. I'm not saying that's a bad amount.
No, I mean, by the time you do a copay and drive somewhere.
Yeah, it's the same, right?
Yeah.
So I'm telling this lady what my issues are. She's from Texas. Awesome. Love Texas. Been there, done that. And so she's like, yeah, that sounds like a client, like a normal sinus infection, blah, blah, blah. I'm going to give you this antibiotic, blah, 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 for this many days, whatever. So here I am. We're going into the holiday Monday. I'm running temperatures, like high temps, even on this antibiotic. And then doctor's office opens on Tuesday. First thing I do is like, I have to go over there. I can't go into the office. I have to be swabbed for COVID because, that's the thing now.
Yep.
Have to be swabbed for the flu. That's the thing now. Doesn't matter whether it's in season or out of season. You got to be swabbed for both.
Mm-hmm.
Then you got to wait so many hours before the test comes back.
Mm-hmm.
So I do a telehealth with my provider.
Yes.
And she's like, I love my provider. She's just straight to the point. She was like, you look like crap. Thank you. I feel like crap. Help me.
This is why we're having a conversation.
Yeah, like I'm calling you because I feel like crap and I need you to help me because this person put me on this antibiotic. And she was like, why the hell did she do that? And I was like, I don't know. That's why I'm calling you.
Right.
So long story short, my provider knows me. She's like, well, that antibiotic's not going to work for you because you have this history and pattern of sinus and upper respiratory infections. Have asthma.
Right.
It just is what it is. I will never do an app like that again.
I think that there is a time and place for those for certain people. Like maybe for me, I don't have an extensive medical history. Most antibiotics work. I'm allergic to one. That's it. And if I needed to, I'd take it again and just, hope the rash doesn't get worse than it was the first time. Like
you're brave. You're brave.
Like it was Benadryl. It's fine. So if I had like an issue where like I had a sinus infection or a UTI or something like that, I could see me just like clicking on there saying, hey, this is what my symptoms are. Can you give me an antibiotic? And then like, yeah, sure. And send one in and I'm good because I don't have a history. I'm pretty healthy. I don't take medicines regularly. I mean, I'm pretty much like a straight shot, easy peasy in and out.
That's what I thought it was going to be. I'm like, it's a sinus infection. Anybody can treat a sinus infection.
Right.
Apparently not.
Not for you though.
Yeah.
Because you're special.
I'm unique, damn it, not special.
Well, there you go. Whatever you want to call it. Whatever makes you feel better about yourself.
Yeah, whatever lets me sleep at night.
And so another issue, and I think of this because I live in the country, is we're saying that this will help with disparities. But what about the person who lives out in the middle of nowhere who doesn't have good internet access?
Yeah. I mean, that recently here on the news, if you follow politics, they just passed an infrastructure bill to help with expanding broadband to rural areas.
Yes.
Because this is a real thing.
It is. It is an issue where I live. And I'm, how many miles is it from my house to here? 20, 30 miles?
Yeah. I mean, it's 30-minute drive, 35-minute drive, something like that.
So it doesn't take me long. Like to be in town, it takes me 10 minutes to get to town.
Mm-hmm.
To my little,
to your closer small spot. Yes.
Yeah. For me to get to a bigger place that actually has like options for internet and things like that, you're looking at about 30 minutes.
Yeah.
30 miles, 30, 40 minutes.
Yeah.
So I don't live like way in the boonies like some people do. But last year I just got broadband.
Yeah.
And it's through my electric company because of that grant.
Seriously?
Mm-hmm.
Wow.
So, and they have a 5-year plan for like all the surrounding counties to get internet. We're like on year 2 of that 5-year plan.
Mm-hmm.
So it's great that they're offering this, but it's still years away for some people.
For some people, definitely.
And this is just where we're at, which is actually really not as rural as a lot of these people. It's like, could you imagine being like out in Montana?
Yeah, Idaho or Wyoming or something.
Somewhere like that. I mean, they're going to be even...
Where there's nothing but like literally land in between.
Right.
Yeah.
That's a whole different, when you're talking about getting hours to getting to like your next biggest city, that's a whole other box of rocks. So that's where I'm like, until, 10 years from now or however long it's going to take for this
to actually get up and started. I
mean, because you gotta, that's cable. You got to run all that material. I mean, it takes time. Just in our little few little miles,
Mhm.
it's going to take 5 years. And you're looking at probably 100 square miles.
Yeah.
So it's not like it's huge.
I mean, it's true, and it is a disparity. It's been, living in a rural area is considered a disparity
Right.
because
And
everything is so far away from you to begin with.
We
to get
touched on that
access
in
to.
a previous podcast.
We
I think.
did.
I can't remember what it was about, what we were talking about. But anyways, it's a real thing. So it
Mhm.
is. There are pros and cons, and I know once we get to a point where everybody is up and running, then it's still, can you afford it? Because I mean, it's still a little costly.
It is. It is. Somebody's got to pay for it. It's going to be the taxpayers. I'm not trying to be funny.
It's our government,
I
Rosa.
know. Yeah,
They're
sure.
paying for it.
Mm-hmm. Right there where it says federal taxes.
That was sarcasm.
Every paycheck I get, right there. That's where it's federal taxes, right there.
I appreciate your helping get me my internet.
You're welcome. You need it. Oh, so although telemedicine has its limitations, it also has its benefits too. Literally, there's an app for everything. There's an app for non-urgent medical care. You got a cold, a flu, a UTI. There's an app for that. There's also an app that allows patients to receive counseling sessions from a mental health provider via call, FaceTime, and or text. There's an app for that. Remember that your telehealth, telemedicine does have its limits and should not replace the care of your primary care provider. Your PCP can give you hands-on care, physical exams, blood work, and other things that are important to your total wellness.
Like understanding you and what's going on with you.
Absolutely. Like I had that bad experience. It may sour me. I'm hoping it doesn't sour other people, but I learned a lesson through that.
Absolutely. Well, and it's important to know, maybe using these apps, that you have to make sure that you're informing this other person who doesn't know you of your history.
Absolutely. Absolutely. And with that being said, telemedicine isn't going anywhere.
No.
I see this probably replacing a lot of that in office, especially for these millennials who seem to love the internet.
Yes. I think that what I've been seeing with the mental health, that it's going to be very millennial driven because
there's an app for that.
If it's on their phone, then they're willing to do it. But if that's how they need to reach out for help,
absolutely,
then so
I'm down
be it,
for it.
As long as the person on the other end understands their own limitations and knows when to have that person actually seek help in a physical way.
Absolutely.
You can find our references on our website, thenursingpostpodcast.com, and subscribe to our podcast on your favorite platform. Be sure to leave your thoughts and comments, and we thank you again for listening to The Nursing Post.